Hello, I am Dr. Miguel Ariza, Medical Director of the Diabetes and Endocrine Center here at Circle Health Dracut. We understand that you may have many questions about your diagnosis, and we are here to help. In this video, we will provide an overview of type 1 and type 2 diabetes and steps for care and self-management. First, let's start with what is diabetes. Diabetes is a condition where you develop high blood sugars. Your body uses a simple form of sugar called glucose as the essential fuel to keep your body and your organs running. The pancreas, an organ in your abdomen, produces a signal or chemical called insulin. Insulin is the key that unlocks the doors in all your tissues to allow glucose to come in and be used by your body. In type 1 diabetes, your pancreas is no longer producing insulin. There is no key to allow glucose to come into your tissues. It is believed that your body's immune system, responsible for fighting infections, mistakenly destroys the cells in your pancreas that make insulin. In type 2 diabetes, insulin is being made, but the key malfunctions and is harder to get glucose into your tissues. Weight gain, lack of physical activity, and a history of diabetes in the family all increase your risk of developing type 2 diabetes. It is important to maintain a healthy lifestyle by eating right and exercising. When you exercise, your muscles use sugar for energy and your cells become more sensitive to insulin, so it works more effectively. These factors work together to lower your blood sugar level. Choose an activity that you enjoy and you will be more likely to make it a habit. Light walking is a great start. If you have not been very active lately or are worried about your health, consult with your doctor before you begin. Set goals for yourself and walk with a family member or friend to keep you motivated. Daily exercise will help support good cardiovascular health by keeping blood vessels healthy and can help support weight loss. Along with exercise, eating right is another important aspect of managing your diabetes. Eating a variety of healthy foods, such as fruits and vegetables, and healthy carbohydrates is a great way to lower your blood sugar levels and keep them within a normal range. Limit food and drinks that increase your blood sugar levels, such as sweets, fried foods, and sugary drinks. Learn how to read food labels. Ask your doctor for more information on a diabetic diet or for a referral to a registered dietitian. Keep in mind, small changes will make a difference in your ability to manage your diabetes and take control. I will begin with a medication overview of for type 1 diabetes. As your body is producing no insulin, type 1 diabetes is treated with insulin. Insulin is administered by injections right under the skin. There are two types of insulin: a long-acting formulation that lasts every 24 hours and meets your basic body requirements to function. There is also a short, quick-acting formulation that is used at mealtimes to process your sugars. The amount of mealtime insulin you administer usually depends on the amount of sugar or carbohydrates you eat with meals. If you have type 1 diabetes, it is critical that you never miss your long-acting insulin formulation. Complete lack of insulin can lead to ketoacidosis, a serious life-threatening complication. Your doctor will help you determine how much insulin to administer every 24 hours and with your meals. There are different medications that can be used to treat type 2 diabetes. Typically, we prescribe metformin, a medicine that makes your body more sensitive to insulin and is often used as the initial choice. There are other options, both taken by mouth or by injections, that can be used to control your diabetes. Taking into account your age, medical problems, and current state of your diabetes, your doctor will work with you to determine which medication or set of medications are the best choice. In order to keep your diabetes under control and help you and your doctor make adjustments to your medications, it is very important that you monitor your blood sugar levels. When and how often you should test may depend on the state of your diabetes and the type of medications you are taking. Your doctor will provide you with some guidance as to when and how often you should be testing. Taking an active role in your diabetes management is important to live a normal and healthy life. Knowing your diabetes numbers, such as your hemoglobin A1C, will give you a good idea of how well your treatment plan is working for you. Hemoglobin A1C is a blood test that averages your blood sugar control over 2 to 3 months. Work with your doctor to set goals that are best for you. Uncontrolled diabetes can lead to nerve damage in your feet, which can cause infections and ulcers. Wash your feet each day and dry well between the toes to prevent cracks and breaks in the skin. Get into the habit of performing daily foot exams and be sure to look for cuts and open areas. Wearing proper fitting shoes and taking care not to walk around barefoot is another way to take good care of your feet and prevent complications. Schedule regular appointments with a podiatrist for foot exams. Eye health is another important aspect of self-care. Over time, high blood sugar can damage the tiny blood vessels in your eyes, which can lead to a condition called diabetic retinopathy. For optimal eye health, schedule yearly appointments with an eye doctor so problems can be identified early and can be treated. It's important to take control and acknowledge your disease. Living with diabetes is not easy, and it can often lead to anxiety and depression. It is important to know that despite being a chronic condition, patients with diabetes can lead a normal, healthy life. You are not alone. Openly acknowledge the daily struggles of living with diabetes. Get family and loved ones involved. Take advantage of the resources your healthcare provider and community can offer you. Participate in support groups to share your experiences and learn from others who also have diabetes. And seek counseling when you find your emotional state is interfering with your diabetes management. You should talk to your healthcare provider when your sugars are too high or if you experience any low blood sugar reactions. Generally speaking, if you have 2 or more consecutive readings over 300, you should call your healthcare provider. High blood sugars could mean that your medications are not working or indicate that you have an underlying infection, are not taking your medications, or are not following a recommended diet. If you have type 1 diabetes, immediately seek medical attention as persistent high blood sugars may indicate a complete lack of insulin in your body and the risk of developing ketoacidosis. Many medications used to treat diabetes can have the unintended side effects of inducing a low blood sugar known as hypoglycemia. This typically occurs if the medication dose is too high or if meals are skipped. A blood sugar value less than 70 is considered hypoglycemia. Symptoms may include excessive hunger, sweats, tremors, loss of consciousness, and seizures. Hypoglycemia can be life-threatening and should be taken seriously. Circle Health is here for you. Our Diabetes and Endocrinology Center is staffed with endocrinologists, clinical diabetes educators, and registered dietitians that can work with you to develop a treatment plan that works best for you. The center offers a variety of services including medical nutrition therapy and diabetes self-management education and training. Also available at Circle Health is a community resource team made up of a chronic disease community health worker, a social worker, and a pharmacist. This team is available to assist and connect you to community resources if you're experiencing difficulty with access to healthy foods or affording medications or any other challenges you're facing that are impacting your ability to take care of your diabetes. Please visit our website www.diabetesandendocrinecenter.com for more information on resources and support groups, or ask your care team for more information.